Hi everybody and welcome to today's EHMA webinar. Today's topic is managing sustainable and resilient healthcare systems, which we're doing in partnership with EUREGHA. So delighted to have you all joining us. I'm George Valiotis and I'm the Executive Director here at EHMA. And this webinar is 45 minutes long, and I'll tell you now how we will proceed practically. So I'm sure you've all become very used to webinars, and today's will be as per the usual EHMA webinar, which is we've muted everyone's mics, and but feel free, if you want to ask any questions, you can type them into the chat at any moment. You can also put your hand up and we will activate your camera and let you sort of join and ask it live. This session's for you. It's for you to get questions answered and learn more. So so feel free to do that. And then you can see point 2 that it's being recorded, and that you can get these recordings on our website usually the next day afterwards. And we're also live tweeting. So if you're on Twitter, feel free to join the conversation. Follow us at EHMAinfo and use the hashtag EHMA webinar, like you can see in point 3. So the agenda for today is you've got this introduction from me for 5 minutes, and in a moment I'll introduce you to our 2 fantastic guest speakers. We've got Valentina Polylas, she's the Executive Director at EUREGHA, and then Andrea Pavlickova, and she's the International Engagement Manager, TEC and Digital Healthcare Innovation. And then at the end, so each of those presentations will be about 15 minutes long. You can ask your questions at any time in the chat, or you can wait to the end to ask it live. And then at the end, we'll have about 10 minutes of Q&A with the audience. But like I said, feel free to ask your questions at any time. So without further ado, now I'll hand you over to Valentina Polylas. Over to you, Valentina. Thanks for joining us today.
Thanks, George. Thanks, Emma, for inviting us to share indeed our point of view on how to build a resilient health and social care systems in the future. And for you to know, I think I am among the others, because I define myself as a lobbyist. I'm the director of EUREGHA, European Regional and Local Health Authorities, and we are a Brussels-based association. So EUREGHA, it's a Brussels-based association of regions, regional and local health authorities. We represent at the moment 18 members coming from 10 countries in Europe, and we work around the topic of health and social care systems, resilience and sustainability. So I think we are quite on the spot at the moment in terms of how we're going to build these health and social care systems that might be resilient for the future of everybody in Europe. So what we do is actually working with the EU institutions here in Brussels, and of course also we really foster the exchange of practices and knowledge among our members. Just to give you a sense of where our members come from, there is a chart here, a map, and of course today I'm going to share also this presentation with one of our executive board members, Andrea Pavlickova from Scotland, and she will really present more case studies, while I will give you the sense of the work that EUREGHA is doing around the topic of health and social care system sustainability. As I said, mostly we work around exchange of knowledge and practice, so we try really to build our vision on this topic. Of course, we are Brussels-based, so the main objective is to influence the policy making at European level, and we also try to embed the change at territorial level, not only at European level. And we do that through the development of projects. We are quite active in project development and implementation, and also with more strategic projects. For instance, we are now also trying to work to build a smart specialization at European level on the topic of health and well-being. That might be linked somehow also to what we are discussing today, but this is more like future activities that it's also embedded in our lobbying strategies, let's say. So today I really would like to share with you basically what we've been discussing for now, I would say 3.5 years with our members, that it's a bit, you know, the vision that we want to bring at European level with the European stakeholders and the EU institution when it comes to talk about the health and social care systems. As I said, I mean, we start this discussion before COVID-19, but most of the topics that we were already exchanged among our members are still valid today. And in 2018, I mean, you can find this paper on our website. We published these health in all regions position papers, which is about, you know, ensuring a vision for health beyond 2020. Why beyond 2020? Because as you know now, there is a new programming period that is starting at European level for 7 years. And we want this programming period to be a powerful tool to really foster this change and ensure that health and social care system can become more and more sustainable and resilient. The first point that I want to address today, and I know Emma had already a webinar specific on that, is the shifting towards a value-based approach in health and social care systems. Actually, that was probably the pillar of our strategy. At that time, there were some of our regions that were pretty much advanced, such as Wales and Catalonia, in this exercise. And more our members are interested in using an approach that is, you know, based rather on value than volume. But when it comes to talk about value-based healthcare, we all know that there are several definitions. We all know that there is a lot of literacy, that let's say the concept was especially developed in healthcare and hospital service systems. But for us, it was very important to really take into consideration a much broader and holistic approach, which means take into consideration specifically the allocative value and also societal value. This is why we wanted to have this discussion at European level with several stakeholders and with the EU institutions to really ensure that when we are talking about value-based healthcare, we take into consideration really from A to Z, also the health promotion part, basically, and also the social component. So allocative value for us means really that we need to be able to reallocate the resources where there can be a high impact in terms of value, and of course disinvest where there is low value. And from a societal perspective, we do also believe that it's important to take into consideration many aspects, the social aspect and environmental aspect as well. So we've been working around this topic, and concretely we thought that one of the main tools, for instance, that we have to promote this shift as public administration is to work through the use of public procurement, and especially public procurement for innovation. So this is why over the years we were also part of European projects such EUREGHA. You can find more about this project on our website again. And we thought that was really the strategic way to align the priorities at a regional level with what can be done by the stakeholders on the ground. And for instance, there is Catalonia, one of our members that is really leading on this exercise. And as I said before, the discussion that we are having at European level was also embedded from our members on the ground. As I said, we represent public administration, so we bear a responsibility towards all the citizens, all the population when it comes to talk about health. So it's very important for us, besides applying this value approach, also work on the topic of health inequalities. And this is also very important if we want to build sustainable health systems, take into consideration the vulnerable groups. And this is, first of all, of course, an ethical imperative, but it's also a priority from a public health perspective. It's a way to address all the broader socio-economic health determinants of health. This is how you can actually build a truly system-based on outcomes that are relevant for everybody, basically. So this is why whenever we discuss our policy and how our policymakers, our members should really apply new approaches in their policymaking, all the time we take into consideration the vulnerable groups and the health inequalities. I was mentioning before the approach that we have in this value-based healthcare. It's broader and encompass as well this promotion and prevention part. So as you can see, there is a specific pillar in our strategies that is totally dedicated to that. We say shifting from drug approach to behavioral changes. This doesn't mean that we don't need medicine, of course, and we don't have to invest in hospitals. But we need to have much broader and holistic view when we decide from a policymaker, regional policymaker point of view on how to set public health policies, of course. And it's extremely important, again, to particularly invest in the promotion part and, of course, also prevention, which brings us to the fact that what we need is indeed to create to invest, especially in community-oriented services. So we believe that indeed the outcome measurement of health should be also based on this whole system approach, basically. This is also pretty much linked to one topic that I'm pretty sure will be addressed by Andrea Pavlickova afterward, which is the integration of care. This is another issue that is quite relevant for our members. And as I said, I mean, I've been talking all the time about the health and social care system, and this is the view that as EUREGHA we really would like to all the time stress, breaking the silos among the two, especially if we want to talk also about health promotion. It's extremely important. And again, this is also important to ensure the resilience of health and social care systems. So for us, it's important to first invest in primary health care facilities as a sort of strategic hub to really have control of the health of the population. And for instance, I'm thinking to concrete example coming from our members. In Emilia-Romagna, they've been investing a lot over the last years, in creating these Case della Salute, so health houses that are also, you know, really close to citizens, because there are several health houses in all the territories, and they become, you know, an entry point to have access to several services that are built around the citizen, basically. And when it comes to talk about integration of care, so yeah, all the time we speak about vertical integration, but for us it's very important, again, as I said, to really break the silos and understand how to put together the social and the health part. There is then a point that probably it speaks for itself, which is how to invest and how to exploit the digital revolution in the health sector. But again, I mean, this is quite self-explanatory, and in all the topics I was mentioning before, basically digital health is underpinning the activities that we are doing. But again, what is important from a public administration perspective, it's also to bear in mind that we need to ensure e-health literacy for everybody, so that this could be really a tool to ensure health for everybody. So from a policymaker perspective, beside the use of the technology in digital health, what we really need to do is also train basically people to ensure that they can have access to the services. And we saw a huge shift, of course, towards telemedicine and the use of apps, especially now with the COVID-19. And of course, there won't be a way back. And we all are very excited because of the fact that we can actually really exploit very interesting tools. But at the same time, as I said before, and I keep on repeating, we need to ensure health for everybody as public administration point of view. So this means that we need to ensure that everybody can actually have the capability to use these tools. So this is where we need to invest, especially, for instance, with the new programming period and the structural funds that are coming from the European Union. There is another topic, but this is really close to the activities that we are doing as EUREGHA, which is the investment in border areas and border regions and implementation of the cross-border healthcare directive. I won't touch specifically on that now, but just for you to know that we have 10 border regions within our association. So actually a lot is happening in border areas because they need to overcome so many difficulties because of the physical border, that I really can consider, you know, sort of pilot for understanding how to rethink a bit the health systems. But I won't go into the details of this. So, of course, as you understand, we are lobbyists, we are a Brussels-based association, so we really try to cover all the European policy frameworks and trying to bring this, let's say, vision in the documents and in the activities of the EU institution. But we also work closely with many other partners, because we do believe that, for instance, if we talk about value-based healthcare, we can't do it on our own, but we really need to share the definition of value, of unmet health needs, and so on, with all the stakeholders. And this is why we are also part of several strategic platforms and also partnerships at European level. And just to mention, for instance, that with EHMA, we are part of this European Alliance for Value in Health that we recently launched. And these are not just purely exercise, because what we are trying to do with this alliance, for instance, really is to bring together our respective members to really share what concretely it means to have a value-based care approach at, for instance, regional level or hospital levels or industry levels. And I think that this kind of dialogue is more and more necessary, because what we address also in our document, this Health in a Region policy paper, was the need for a multi-stakeholder dialogue. And I can assure you that at the very beginning, when we start this journey, also for us as a regions, wasn't that straightforward to have a dialogue with the industry, for instance. So I feel like in this 3 years and a half, things are changing step by step, and this is probably the only way in which we can actually ensure health and social care systems. So addressing those pillars, but also really understand that this exercise has to be done in partnerships. And this is why, for instance, also the activities that we were promoting through the procurement and public procurement for innovation, they were a very good exercise for us to really foster and improve the dialogue, for instance, with the industry. And this is key. And this is key if we really would like to start allocating resources also in the right way. So more and more we will work on all these topics. And as you can see also from the other slide on European policy framework, there are several, let's say, avenues for cooperation also with the institution. Last but not least, for instance, as you know, in the new programming period, for instance, also the use of the, let's call it regional funds, which is European structural and investment funds, can be dedicated to health investment. But it's very important that we link these health investments also to the European semester cycle that helps basically also to coordinate the investment and the actions of the member states at European level. So it will be crucial because, of course, if we don't shift altogether, for instance, towards a value approach, well, things won't change because the system won't create the right incentives to adopt a value approach if we are all working on volume. So this is why, for instance, using the country-specific recommendations at European level with the European semester cycle, we can actually push also member states to rethink the health and social care systems. But these are, food for thought to also understand how we can cooperate together in terms of advocacy and lobbying, because in the end, we know that it's also, a member state's legal responsibility to work on these topics. And last but not least, beside the use of the structural funds, the use of, let's say, this strategic monitoring system at European level, we can keep on also investing in projects in research terms, and this is what we want to do also within EUREGHA, especially with Horizon Europe, and keep on investing a lot, for instance, in the activities that are relating to procurement. So here, for instance, in my presentation, you will find more details also of the different projects we are part of, that we are keeping implementing, and I will be more than happy, for instance, to receive your question if you have any curiosity about the activities that EUREGHA is developing. And now I think it's probably time for Andrea to really give a concrete example on what's happening on the ground from a regional perspective. Thank you very much, George.
Thanks very much, Valentina. You've given us a really great overview about the various topics that sit within this umbrella of building resilient services and health systems. So in order for us to also just test where the audience is at, we're just going to launch a quick poll now, and we're going to ask you guys as well to let us know. It's a multiple choice. You can answer up to 3. So if you could just pick, what are the three key elements for a resilient health system? Now, I know you could pick all of them, but in your mind, from your perspective, if you could just pick 3, what would you pick? Once you've ticked your 3, press submit, and then we'll have a look at how that compared across everyone who's attending today. So you can see a pretty good mix, but the one that got the most was integration of health and social care services, with 61% of people choosing that, followed closely by community-based services, governance, and then health and social care workforce. The ones that got the least were medicines and infrastructure, interestingly. Terrific. So thanks very much for sharing your views. And now with that sort of overview, let's have a look at something more concrete by handing over to Andrea Pavlickova. Welcome. Thanks for joining us, Andrea.
Thank you, George. Good afternoon, everyone. My name is Andrea Pavlickova, and I'm International Engagement Manager with Digital Health and Care Directorate at Scottish Government. And as it was said by Valentina and George, I would like to give you a very brief example of Scotland and how we kind of manage currently the resilience of our health and social care system. So just for those of you who probably don't know Scotland very well, just very briefly, Scotland has a population of 5.4 million, and we have a devolved parliament, which means that basically organization of health and social care services in Scotland is the competence of Scottish Government. So NHS Scotland really differs from NHS England or NHS Ireland. The care is organized in 14 regional health boards. We then also have 8 special boards and 31 integration authorities. So these are our health and social care partnerships, which jointly deliver health and social care. So Scotland, similarly as other countries in Europe and beyond, faces a number of challenges when it comes to its healthcare system, such as higher public expectations, higher public expenditures, access to healthcare services, and obviously all the consequences of aging population. And all these challenges have obviously profound impact on the sustainability and effectiveness of our health and social care system. But what is also important to mention that it also has a strong impact on the quality of the delivered care. In Scotland, there are really 2 underpinning principles how we try to address this challenge. First, one is really this integration of health and social care. In Scotland in 2014, we have delivered a formal legislation which basically introduced a duty boards to jointly deliver and plan just the social and healthcare services. So in 2014, we have published this Public Bodies Act. And as you can see from this framework or from this overview, for us, this has been really long journey. So, starting back in 1999 and then through various initiatives and strategies, we are basically finished at this level of legislation. So this really just emphasizes the strong commitment and political vision for the integration of health and social care services in Scotland. Other very strong pillar for us is this belief and commitment to the digital technology, and really this vision that if embedded properly in the service design, the digital technology has the potential to change the face of health and social care delivery. This is very well embedded in our strategy document. So we have a dedicated health and care strategy in Scotland, which was really written very much from the citizens' perspective. So it's all about how the citizens are accessing health and care information, how this data can be shared in an integrated way, within a secure way throughout the system, with an overarching result, which is obviously improve outcomes for the individuals. The reason why I'm mentioning these two pillars is that actually COVID-19 has not changed too much from that perspective. It has basically just reiterated or re-emphasized for us that there is even greater urgency to shift our care services to really integrated way with that underpinning principle of digital technology being embedded in the service redesign. And the reason why I'm saying that this urgency is in great causes is really very profound and long-lasting. It's a very destructive process that health and social care systems in Europe are facing. Healthcare professionals, healthcare providers, but also us as citizens, we are facing continued uncertainty. So there are continuous new waves of COVID-19. There is a different pace of the vaccination program going on in Europe, and at the same time, the healthcare system are still coping with the increasing demand on their care models. So basically, in conclusion, what we can say from this existing situation is that probably healthcare will never go back to how it was, and maybe it should never be. Because I think what we can also see, despite all the challenges and the challenges that the healthcare system are facing, is that we also see really good practices that the regions and countries are implementing in Europe, which are helping to cope with the COVID-19 in a very successful and innovative way. So I think in all those kind of like negative sense, we should not stop thinking about those successful cases that we also see in Europe. I have picked up this example of healthcare recovery framework because I thought that it's a quite nice visual of the different phases that pretty much every country in the world is now going through. So there are 3 different phases that the healthcare system are probably tackling from this kind of COVID-19 perspective. Obviously, the first point is starting to managing the outbreak of the COVID. Then the second phase is around the existing containment measures that are implemented across Europe. And then this third part is this resilient new reality. So how to actually build a much more sustainable and prepare healthcare system to face future, potential future pandemics. And there are 5 building blocks of this resilient new reality. It's about developing new care models, digital delivery, resilient operations, workforce agility, and financial governance. And in my case from Scotland, or in my examples from Scotland, I would like to particularly cover this aspect of resilient new reality. So for us, the overarching document which outlines this new resilient reality is this strategy Protecting Scotland, Renewing Scotland, which is government's program for Scotland 2020-2021. And in this, the government sets out key actions or key priorities how to respond to COVID-19 from various perspectives, obviously taking into account public sector, but also wider economy. And obviously healthcare is one of the key part of this program. And there are a number of priorities or emerging topics that are coming from this response to COVID-19 from the government program. Obviously, it's around the remobilization of health and social care services. It's about the issue of accessing health and social care services, but also about empowering people or citizens with the tools to access these services. Other important aspect of this program is about identification or kind of like expansion of the key programs which are currently running in Scotland, and make sure that we actually concentrate on its really rapid scale adoption at national level, improving the access with the overarching objective to improve the access to digital care for both physical and mental health. Another element of this government program is about development of new programs as a response to COVID-19. And one of the topics which has been really, I would say, cross-cutting across various aspects of various public sectors is obviously inclusion and digital capacity. And then secondly, I would say the biggest overarching theme, and what we've also heard from Valentina in the initial presentation, is that at whole resilience is about the partnership and collaboration. So in my next slides, I just would like to give you a couple of examples of what we are doing across these four areas highlighted in green. So first one is around rapid scale up to improve access to digital care. So in Scotland in 2014, we have launched this national program called Technology Enabled Care, which is very much focusing on empowering individuals through the delivery of services which are supported through the digital technology. And main activities of these programs currently are really about mainstreaming of these digital solutions, and they are scaling up. And there are various work streams of this program, but they have picked up for the purpose of today just two. One is around our video consultation service. So this is basically our national video consultation program, which ran from February 2020, as you can see on the bottom of the slide, when we have started implementing this online consultations. We have around 300 calls per week. And as you can see, as a result of COVID-19 in November 2020, this number of calls raised to 18,000 per week. And currently, as a result of the evaluation report in 2021, on average, we are talking about 20,000 calls per week. So this is a great example of how quickly, actually within 12 weeks time, we were able to scale up this video consultation service. It's called Near Me, and if you're interested to hear or learn more about the service itself, you can access it on the tech website. And also I would like to draw your attention to our evaluation report, which basically was published just now in March 2021, really drilling into details on how COVID-19 has impacted this service. And one thing which I forgot to mention, it's not only about the number of the consultations, but also its spread. Like when we started with the service, it was primarily delivered to secondary care services. Meanwhile, now it's also used in the primary care and outpatient services. So it's also the expansion of the scope of the service. And as a result of this, success with the service in the Scottish Programme for Government, it was also highlighted that basically these virtual consultations will now become a default option for delivering of health and social care services. Obviously, when this is right for a person, and if the people or persons are happy to use this service. And when it comes to the this aspect of satisfaction with the service, we have also had a public consultation where we ask users on their experience with the service, and over 87% of participants in the survey were really happy about this service. Another example of really rapid scale up is around mental health. Obviously, we don't have to drill into the details to understand how COVID-19 has impacted mental health and well-being of people, particularly also young people recently. And again, if you look at the figure, we can see that when we started with the referral of around 2,000, which has then gradually moved. But if you look in September 2020, the referrals is over 26,000. So again, very rapid scale of the service. And as a result of this successful scale up, we also see that these digital services are, the expansion of new digital services in the area of mental health. Elements was mentioned in the Scottish program, Scottish government program is, as I mentioned, refocusing or expanding our existing programs. So in Scotland, we've had really long or big national program around health monitoring of health condition, particularly looking at hypertension self-management. But as a result of the COVID, we have actually had to refocus that work, and instead we have developed tele-COVID-19 app, which helps to monitor conditions of people who have been diagnosed with COVID at their home. So basically, this is about a possibility of early detecting in case their conditions deteriorate. So for instance, they are getting home oximeters or thermometers to manage their conditions, because what we know is that the levels of oxygen in COVID-19 patients can really change profoundly without showing any other symptoms. So that early response is really critical here. Another example of how we are kind of like shifting or expanding the current work is around the telecare. And here I didn't want to drill too much in detail, just wanted to mention it again as a response to COVID-19, but I think also kind of like long-term work. We are shifting the service reactive, so when from being reactive to proactive, so we're not concentrating only on what kind of services we deliver once the alert has been received, but really trying to proactively manage those who are dependent on this service. And currently in Scotland, we have around 200,000 vulnerable people in this situation. And the third element of kind of like our resilience program is around building new programs. So I just picked up, for the purpose of today, the example of this Connecting Scotland program. And you may recall that I've mentioned this important aspect of digital capacities and digital inclusion, which is basically, as I was saying, kind of like a cross-cutting team of our response to COVID-19. So this program is basically has one key objective, which is to basically get every citizen in Scotland online. We have realized that digital solutions, internet, have really made profound changes in people's lives during COVID, not only from the perspective of accessing health and social care information, but also being connected, informed, entertained. But not all have the skills or confidence in using these solutions, or having their kids and connectivity at home. So this is basically the initiative to basically make or support everyone in online. And one example of the activity that are getting out as a part. So again, I think that you probably all experience in your countries very similar situation, that actually elderly homes have been really severely impacted by COVID-19. So we've been kind of like investigating or monitoring how digital services can improve health and well-being of older people, but also how they can support the staff in the care home. So we have been monitoring what kind of services and solutions we currently have, and what are the potential gaps. And as you can see, this work is based on three pillars, which is the digital foundations. So this is basically about investigating if there is a connectivity, if the devices are in place. Then the digital services, so this is about monitoring what services we have and what services we can offer externally, for instance, like this near-me video consultation services, which I mentioned earlier. And then digital leadership and skills, so this whole work around education and making sure that everyone has the skills to use these solutions. And to conclude, what have we learned so far in Scotland? So again, I just picked up this quote and this reference because for the audience. Audit Scotland has published in February 2021 a review, or kind of like a summary of the lessons learned for NHS Scotland from the pandemic. And it was quite interesting that basically the key message of this document was that NHS was really very proactive or quick in a way how it's prevented all the kind of like impact of COVID-19. But obviously there was a conclusion that we could have been much better prepared to respond to the pandemic. And ironically, Scotland is quite well known for having strategy pretty much for everything. But what was pointed out in this document was that actually the reasons why we have not been so quick or so well prepared for this pandemic was that actually the last strategy for responsiveness to the pandemic was not renewed since 2011. And despite of the fact that there were a couple of interventions or improvements which were recommended as part of this, they were never implemented. Other aspect which were mentioned as part of this review was that COVID-19 has definitely deepened health inequalities in Scotland. So we see that the COVID-19 has a different impact on vulnerable people due to either geographical location or sometimes ethnic origins and so on. Other example, a message which I quite liked from this audit was that we have to basically realize, as I was saying earlier, that managing this change due to COVID is really long-lasting, very disruptive, and we need to make sure that we keep learning about this response active, and more importantly, we act on this learning. And again, not surprisingly, the main message from the other kind of a key message from this document was about the need to continue collaborating and working together across the partnerships, across the sectors, but also across the regions and countries in Europe. So I think I'll stop here. Thank you so much for your attention, and I'll be happy to take any of your questions. Thank you.
Thanks very much, Andrea. That was a great presentation. Great to see some really concrete examples of how these concepts that that Valentina was presenting before are actually being implemented at a state level. We are actually over time now. So if people do have any questions, we'll just add a few extra minutes. If you're able to stay on, please do join us. We've got one question from the audience that I'll come to live in a moment. But my first question to both of you is, maybe I'll start with you, Andrea, and you can add, Valentina, if you have something, is how are health managers involved in these building of these strategies? Like some really great health concepts there, but in terms of health managers who are actually then delivering on these strategies, what role have they played on the ground in developing strategies or contributing to them?
I think, from Scotland perspective, I think what we've been, like embedding really very well are public consultations. So we really need to really try to make sure that when these strategies are prepared and built, that they are run through, all the kind of like stakeholders and actors that are necessary to be involved. So mostly for us, the main kind of like vehicle is the public consultation, and obviously we always make sure that the task force and other kind of like task force and other kind of like entities responsible for the development of these strategies are always kind of like around the table to provide the inputs as necessary.
Great, thanks. Valentina, do you want to add anything to that?
Well, of course, I'm not myself an health manager, so it's a bit difficult from my side to add. But the thing that I can say is that for sure, I know that the activities that we are doing also at European level really support what is happening also on the ground. And our members, they really pick up on the inputs that they receive from the European level. This happened, for instance, with the public consultation in Catalonia around the topic of value-based healthcare. That was actually built on the discussion that we were having in Europe and led by EUREGHA. Great,
great. So there's a question from Annalise. Annalise, you want to come in live and ask your question? And while we wait for you to connect, there's also a question from Jacek who says to Andrea, is there any research on the quality of growing number of teleconsultations?
Yeah, that's why I was kind of like picking up that evaluation report, because it actually quite nicely kind of like brings both elements, quantitative and qualitative. So I would just like to refer to that qualitative report, and I'm happy to, that evaluation report, sorry, and I'm happy to just send you the link after the webinar so you can circulate along the presentations.
Right, and so we'll be putting up a bunch of resources, including any of the slides that we're able to share up on our website. So, so that link I shared with you earlier, you'll be able to access it there. And my colleague Chiara will also email everybody who's attended the link where you can find all of this stuff listed, or all the referral links. There's a question from Jen Complex. Is there any action or program to support healthcare workers during current pandemic?
Yeah, definitely. So as you kind of like, as I mentioned in that kind of like strategic framework, the workforce agility is really the key component of that whole new resilience aspect. I mean, I haven't picked up personally myself this program, but I mean, again, I can just share it afterwards.
There you are. Hi, Annalise.
Hi, George. Good to see you.
Nice to have you here.
Yeah. I'm at our annual conference in last year. We talked a lot about value-based healthcare, and I'm sort of extensively thinking about how to implement it concretely. And I didn't know EUREGHA before today. I didn't know anything about it. But if the mission of EUREGHA is to provide healthcare, comparable healthcare in all regions, if I understand that properly, Valentina, then what is your strategy in defining values of what people expect from healthcare, because that is the basis of value-based healthcare, and values are culturally defined. That is, you know, so how do you deal with that in EUREGHA context?
You're asking Annalise really about, because the key question really is, how do you value how the patient values their care or the outcomes that they get?
Yeah.
So how are people measuring them? And it is truly the question that comes up routinely, and sort of the big question. And Valentina, have you ever come across an answer that has satisfied you, or have you seen anything of interest across your members?
Yeah, the reason why I'm asking that, because it's your mission.
Not yet, but for sure we are especially working on the topic of outcome measurement. So there, for instance, is where you can build, let's say, a common ground that could help really in fostering this approach across Europe, basically. So the more and more we try to really compare also what is happening in terms of collecting outcomes, for instance, across the different member states and across our members as regions. And I'm not saying that this is going to happen overnight. You know, it's a very long process. And besides what is, outcome measurement from PROM's point of view, we are also working on what is the experiences, for instance, of patients. But having said that, as I said, we are also having a much broader approach to value-based care. And this is why, for instance, through the use of also this coalition and alliance, and we have now, this new alliance also with EHMA, the European Alliance for Value in Health, where there is, for instance, a nice environment where we can actually work to really understand what we define by unmet health needs, what is the definition of value. But it is a matter of fact that in terms of this definition and how to involve the stakeholders on board, well, we are probably at the beginning of a journey at European level. So we are working on it.
Terrific. Thanks for that, Valentina. And actually, EMA is also working on it, and we really would encourage people who want to have this conversation further, whether you have some great work you want to present about what you've done on value-based healthcare, if you've got anything great on measuring patient outcomes, I would love to hear about that, or any other work that relates to health management. You still have a chance to get your abstracts into our conference, and our early bird rate is still available if you want to attend until June. So I know that many of you probably would have come to our conference before, but we really look forward to having you join us. In the chat link, my colleagues just put a link to the conference page where you can get more information and see how to register. So do look out for that, and I look forward to seeing you there. I want to really thank Valentina and Andrea for two really great and informative presentations. Thank you so much for both of you for joining us today. And all of this information will be up on our website. As I said, my colleague Chiara will email you all the attendees links to be able to find more information. So thanks very much. Have a great day and take care. And we'll see you at the next webinar, otherwise at our conference.
Thank you, George.
Thanks a lot. Thank you.
Bye.